Welcome to the Retire with Peace podcast, the podcast where we help you create a fulfilling and stress-free retirement. Each week, we bring you expert advice, practical tips, and inspiring stories to help you plan and live your best retirement life. Whether you're nearing retirement or already enjoying your golden years, this podcast is here to support you every step of the way. Let's embark on this journey together and discover how to retire with peace.
Welcome back to the Retire with Peace podcast. As always, I'm your host, Dave Zegel. And there's an important piece of legislation that has not happened this year and likely will not happen. And it's going to impact some people's retirement plan. So we just had the official name is One Big Beautiful Bill Act. It just got passed several weeks ago. And it extended, it made permanent, it really took a lot of what was in the Tax Cuts and Jobs Act many years ago that was going to expire at the end of 2025. And it made a lot of those items permanent, or in some cases it just modified them, or it enhanced them and it added in some new items. But for the most part, the things that we were watching to see if they were going to expire at the end of 2025, for the most part, those continued on as they were in the Tax Cuts and Jobs Act with some modifications. But for the most part, it's a little bit business as usual, plus some additional deductions and income phase outs, all the stuff we have gone through in a previous episode in great detail. But there's one item that wasn't from the Tax Cuts and Jobs Act, but it's set to expire at the end of 2025. And that item is not addressed, and it most likely will not be addressed or extended. And that is the enhanced premium subsidy on Affordable Care Act insurance. During the pandemic time, part of one of the bills was an enhanced subsidy on the Affordable Care Act premiums. So those getting insurance through the Affordable Care Act saw rates decline, and it also fixed the cliff that you see when you get to higher income, where the subsidy just completely goes away at a certain income level. And I'm not going to go into all the different details of income levels and the poverty level rates and what that means for your subsidy and all that different stuff, because those calculations are pretty insane, and they're all tied to your tax return. So I'm not going to go into details on those calculations, but this is more of a warning, or just to make sure you are aware that if you were on the Affordable Care Act insurance, your premiums almost certainly are going to go up in 2026 because this enhanced premium subsidy goes away. When it was passed during the pandemic, it was set to sunset in 2025, and it doesn't look like anything's coming along to extend the enhanced subsidy. So we know that the Affordable Care Act premium is almost certainly going to be higher for you next year if you were on that insurance. What do we do from a planning perspective? Well, even before factoring in the expiration of this enhanced subsidy, what we would do is either build in the additional cost of the Affordable Care Act or plan for a lower income if we can to try to keep some of that subsidy and help overall with the tax picture for the client. And I say overall for the tax picture because if you think about how the cost of the insurance is calculated, it goes through the tax return. So if you paid too much premium, you get a little extra refund on your tax return. If you paid too little premium, you pay more tax on your tax return. So that insurance premium is effectively a tax because it's calculated on your tax return. Yes, I understand it's an insurance premium on the insurance policy, but the ending cost of what that premium is finalized on your tax return, and it's adjusted higher or lower based upon what your actual income is. So if we think about tax planning in total, if we can do things to decrease the insurance premium by managing our taxable income lower, we've effectively lowered our taxes. Conversely, if we decide we need to do this tax planning, or we need to do Roth IRA conversions and intentionally make our taxable income higher now because it's going to benefit us long term, then we have to factor in that additional insurance premium as an extra tax and determine, is it worth it to have that extra tax on the extra income that we are intentionally generating through things like Roth IRA conversions. So it's not that there is one right or wrong answer. It really does depend. I know everybody hates that answer, but it really does depend on the individual situation, what we're trying to do long term from a tax planning perspective, and is it worth the cost of paying a higher premium? Or do we really need to reduce our income if possible to get that premium down? Now, when I say reduce income if possible, we're thinking about this, we're talking about people who have not attained Medicare age. So they have to get some insurance for their own protection. And maybe they've retired at age 62 and they're looking at this saying, okay, how do we get our taxes down? Well, we could take more money from a non-traditional IRA. So you have a traditional IRA, you can have a Roth IRA, or you can just have a brokerage account or a savings account. Well, we want to take more of our income from that brokerage or savings account and less from the traditional IRA in order to make our taxable income smaller and get more of a subsidy from the health insurance premium subsidy. Conversely, we could say, hey, forget the subsidy. We need to manage this tax long term. We're going to be okay with the higher income. In fact, we might do a Roth IRA conversion to make income even higher. And we're just going to factor in that cost as part of the tax bill. Now, that's not a fun cost because it can get to be quite substantial. But again, we really have to calculate each person's situation. And in some cases, we'll do it year by year where we say, we want to make sure our income is low for these 2 years. And then maybe in year 3, we have a higher income, or vice versa. Maybe we have a higher income this year and we're going to back off the next couple of years. We have to run the numbers and see what makes sense from a long-term tax planning perspective, knowing that this cost is just there. We can't really get around it. You're going to either pay the higher insurance premium now, or we're going to save on the insurance premium by keeping the income lower, knowing that maybe our traditional IRA is growing more. We might have to pay more tax on that later when we're required to take it out when we get into our 70s. So there's not one right or wrong answer. We just have to manage that health insurance premium as an additional tax or tax savings, depending on where we want our income to fall. But this is more just a public notice to say, if we're planning for 2026 already, which we really should be, but certainly if we're planning for 2025, maybe this is a good year to have our income be a little bit higher because we might be able to get more subsidy this year than we will in future years. So that's not an answer for everybody. That's a maybe. Something to consider is the fact that we're going to get a higher subsidy this year in 2025 than we will going forward. Maybe it makes sense to pull forward some income, knowing that in future years, we're not going to get as much subsidy. Again, all planning long-term around taxes, but just be aware that that enhanced insurance premium that was passed during the pandemic, I believe it was 2021, maybe 2022. I don't remember the exact year. It's one of those two. It was passed in that year. It's set to expire at the end of 2025. It doesn't look like any fix or extension to that is coming. So plan accordingly. There's no right or wrong answer. We just have to understand that that's the case going forward. This enhanced premium subsidy that was set during the pandemic, no more starting in 2026.